Hey everyone, this is Dr. Ryan Spurgeon here, and I just want to do a quick video giving you another office tour. I know I've done one just a few months ago, but things have kind of changed around in the office, and they'll probably continue to change. But I did just kind of want to update you as to what the current state is. Hopefully I'll kind of keep up to date with some of these videos, and so you continue to have an idea of what you'll be looking at going into it. Today it's late January, so this is currently the office. I'd expect it to stay somewhat similar for at least the next couple months, if not much longer. But without much more delay, I'll give you an idea of what the office looks like in its current state. All right, everyone. So here is our quick tour. I'm going to try to kind of get through this fairly quickly, but I want to be thorough as well. This is the front, the reception area. Essentially, this is kind of what you'll see on the right as you walk in the door. Actually, I guess I may as well start over in the parking lot, because this is what you'll see first drive up. This is Santa Fe Street. We're on the corner of Santa Fe Street and Kansas City Road. There's a sign on this right on this building here that has kind of my red and black and white logo there, so you will recognize that. Otherwise, you can recognize there is an alcohol help center sign out front. But essentially, that's kind of your landmark. You'll see the Alcohol Help Center sign. This is the treatment room. Got a couple tables, some different equipment. I'll try to go through some of that so there aren't too many surprises. This is one of our tables. Well, both of the tables are the same right now. Eventually, I'll bring probably a Atlas orthogonal full-on table over here, but currently we just have the I have the portable instrument, which it works great. Had some great results with it over here. This is the one of the tables here. It's lifted up right now, so it does raise up for me. This has the flexion piece, where this bottom piece kind of flexes like that, and that helps with low back conditions, kind of opens up the spaces between the lumbar vertebrae. Same thing happens with the cervical spine. This piece flexes down, kind of stretches out the neck, opens up the space between the vertebrae, allowing those discs to kind of have more movement and potentially hydrate. Alright, so some of the other instruments that we'll use the activator. If you're not familiar, goes like that. I'll put that on different areas of the spine, extremities, and typically I'll use it for a lot of muscles, to kind of get some of the muscles to calm down. It shoots a pressure of anywhere between 8 and 38 pounds of pressure per square inch, depending what the setting is. This is the Body Sport. It's kind of a high-powered massager that works real well. Typically I'll aim for some of these muscles that are kind of torquing on the vertebrae in ways, or extremities potentially as well, like shoulders and such. Getting those muscles to really relax so we can improve alignment from there. The other few other instruments we have, the SOT blocks. This is a real gentle, easy way of using gravity to level out the pelvis. We set that under different areas of the pelvis, specific points. When the pelvis is kind of torqued out of position, if we put those at specific points, it will allow gravity to kind of allow the pelvis to kind of shift back to neutral. We have the posture pump. You can see that's out right now, so that can sometimes help after the treatment to bring some of the curvature of the spine back. Besides that, we do the soft tissue treatment, kind of neuromuscular re-education is what I call it, where that's kind of tends to be most people's favorite, I guess, especially on the neck. It's where we put pressure on certain different points of the cervical spine, getting some of those muscles to relax, and then kind of torquing those vertebrae back into, torquing sounds extreme, but it's a real gentle technique, but it will kind of shift those vertebrae back to a neutral position for you. It tends to work pretty well. Then, of course, we have the Atlas orthogonal adjustment as well. Cheyenne's hard at work again. Anyway, I will show you the rest of the office here quick. Again, this is we have some offices where some counselors work out of occasionally. Anyway, this is the back here. We have the restrooms. Clean, simple. Sun's peeking out here in Olathe. All right, so that's about it right now. Hopefully this tour has helped you. Okay, everyone, so hopefully that gave you an idea of what you'd potentially be walking into should you go ahead and schedule at this office. I know oftentimes when you have any type of condition as far as headaches, neck pain, jaw conditions, anything going on at all, if you're in pain, it's natural for you to kind of feel like you're kind of in a bad mood. You'd probably be feeling a little more vulnerable. You don't want to walk into something not really knowing what you're getting yourself into. So with that being said, I try to be as transparent and honest and just kind of forthright with every aspect of this office as I can, as far as your care goes and what you're getting, what to expect. I try to have no surprises in that way. I am a one-man show right now in this office besides Cheyenne, my helper, who you've kind of already seen. I do all the billing, all the finances, all the scheduling. I work currently with Blue Cross Blue Shield, Cigna, United Healthcare, a few other insurance companies. If you have any questions, concerns, please, by all means, message, email. My email is drryan@healingneck.com. I've got, you can text or you can either call or send a text message to my number at 913-353-6655, or you can schedule online at healingneck.com. Thanks for sticking with me through this long video, but take care, and I hope to see you in the near future if I can help you.